Genomics to me means the first thing I think of is excitement, because it means sort of improvements in healthcare, and the idea of personalised healthcare rather than a one size fits all. So I think it's yeah, excitement is the word I would use, that people are going to get better quicker, which as an NHS worker is your main sort of raison d'etre really. It means hope. I've been lucky enough to see lots of amazing outcomes from my sort of early days working in the genomic medicine service, particularly with regard to newborns, pregnancy, and children. So lots and lots of reassurance for parents and future generations of people who hopefully won't get poorly, but if they do, there's a much more positive outcome for people. Well, I should say first and foremost, I'm not a clinician. My background was in education. I worked in research in mental health for a long time, and then I got a job at Liverpool Women's Hospital as an education and training coordinator on the 100,000 Genomes project, which was just starting recruitment in the Northwest. So I knew nothing about genomic medicine at all. So I really was starting from scratch, but I did have an educational background. So my genomic journey has really been from the 100,000, which was sort of recruiting people in and speaking to people, introducing them to it. And then obviously we had the COVID-19 pandemic, which I do class as part of the genomic journey, because suddenly there was an awful lot more interest in genomics and testing and research out there. There was a massive upturn in patients being involved, and suddenly everybody knew what a genetic test was. People were doing tests regularly on themselves for COVID. And then after COVID-19, I got the job within the Northwest Genomic Medicine Service Alliance as a genomic educator. So I'd had sort of 5 years experience, and then I started genomic educator, working primarily educating staff. So that's been my journey. It's been an awful lot of learning, but it's been really interesting to kind of be at the start of healthcare rather than kind of later on in healthcare when people actually have got ill and are sort of trying to get better. I'm excited every time I hear a staff member say they've heard of genomics or have done some training, as I know it's via either some work I've done or those I work with. So it's sort of training that people want to be involved with. For example, people are getting in touch with us asking for genomic training, and I'm looking forward to being involved in things like the Progress Project, so turning that into inclusive education for staff and for patients that will suit like all training needs across the board, and hopefully getting back to some face-to-face training and networking for staff, because I think that's really, really important. And obviously after the pandemic, that things have changed in the workplace, but as an educator, of course, I'm going to say that I think face-to-face training is just as important for staff, especially staff who've maybe been working in isolation quite a long time, to sort of spread the word about genomics. And I'm also really excited about continuing to work with such a sort of top-notch team as the GMSA, sort of really passionate people, and really who are already amazing at their clinical jobs, and are bringing that into the Northwest GMSA. Well, obviously, loyally, I would always say that being involved in meeting recruitment targets for the 100,000 Genomes project for the Northwest Coast was a massive project to be part of, and I'm really, really proud. I'll always be really proud of being a part of that, and proud to say that I'm from the Northwest Coast, where so many patients got involved with that. But more recently, in my current role, it would be probably the pharmacy talks that I did with Jessica Keane and later Ben McIntyre. And we went from seeing just maybe a handful of pharmacists, extremely busy people, busy working environments, to suddenly there was a real demand. So I'd say in our first group we saw about 5 people, and then suddenly it was like 50, with people logging in to see these talks. So sort of the word spread and that it was beneficial. So we went from seeing just a handful of people to suddenly a real demand, an actual pharmacist asking us back, seeking us out. We've been asked for recordings of the training, because obviously we can't go to every trust all the time, which is fantastic to have that kind of demand within pharmacy. And then later with working within the genomic cafes, pharmacists who'd missed the talk were coming down to the genomic cafe stand and having a chat with us about those kind of things. So it's wonderful to sort of be back within the hospital, people knowing who you are, people coming to speak to you, hopefully not just for the freebies, but to get sort of information and further education. So that's what we'd like to continue more. We'd like to continue that sort of high level reputation, and knowingly people are coming to look for us as an excellent educational source and resource.